Welcome back. And Austin Lawmaker is taking the lead of the several public health issues. Elliott Naishtat, Representative Elliott Naishtat, is here with us right now. Vice Chair of the Public Health Committee in the House, you guys recently talked about the state's vaccination registry. Right now it's an opt-in system, but there are some people that want to make it an opt-out system. But this has been a kind of a long time debate. Why is it so contentious?
It's contentious because there are, in my opinion, too many people in this state, including legislators, who don't want to get their kids immunized, and they, for privacy reasons, don't want there to be an immunization registry where you have to opt out, because it's much easier to be able to just opt in, to give consent to be part of it. They want to have that control. If we move to an opt-out, then everybody is automatically entered into the registry unless you opt out.
I understand this is a topic right now because we've had more cases of whooping cough in the state than we have since the 1950s. You guys talked a lot about that. Do you feel like that's going to have any impact on where possible legislation might go next session?
I think it will, because there's a focus on pertussis, whooping cough. And the fact of the matter is we have the highest incidence, the highest rate of pertussis in 50 years. We had, the numbers aren't exact, but 3,500, 3,700 incidents of whooping cough, and we had 5 kids die in 2013 and 1 so far in 2014.
So it's easy to kind of, I guess, understand the whole idea of making a registry opt out when an epidemic like that happens.
Yeah, when there's an epidemic, when we have parts of the state where if you look at a registry, an immunization registry, and you can see that people have not been inoculated, have not been vaccinated, and then you can look at where pertussis is breaking out, and if you can make that connection, then the state and the private sector can move in and try to do whatever is necessary to prevent these outbreaks from continuing. Having a registry which includes as many people as possible, including children, is much better than having one where you have to give your consent, and so it may not be as comprehensive as a registry where everybody automatically is entered unless they say, no, I don't want to be.
MTRAC has existed in the state since 1997, and this debate has really gone on since then. Do you foresee any legislation coming out of the hearing that you guys had this spring?
Yeah, I do. First of all, we are going through, it started in 2012, we are redesigning or trying to reorient it, basically fix the MTRAC system. It needs some fixing, it needs fine-tuning, and one of the purposes of the meeting was to see what kind of progress has been made in relation to redesigning MTRAC. At the same time, we've had this problem with pertussis, which everyone knows about. And at the same time, we had legislation last session sponsored by Representative Donna Howard from right here, which would move the state to an opt-out system where you have to tell the Department of State Health Services, I don't want to be part of it. That's cheaper to have that kind of system. It's more efficient. The fact of the matter is 95% of Texans would like to be part of this registry, and it's much easier and cost-effective to have those 95% registered automatically than to go through the bureaucratic red tape, providers have to do this, of entering those numbers because people say, I want to have that kind of option. I want to have to be signed in. I don't want the state to automatically do it. But then you get into some privacy issues, and what's clear based on the testimony in the Public Health Committee is that these privacy issues are being and will be addressed. It shouldn't be an issue, but it is.
With our recent outbreaks, how likely do you think that an opt-out bill or legislation is going to happen next session?
Oh, I'm quite confident that it will happen. I have visited with Representative Donna Howard, and she is seriously considering introducing that bill again. It had a lot of support. I think they basically ran out of time. So I believe it will be introduced, and I think it's important to move in that direction.
Knowing that this opt-out legislation is coming, how likely do you think it is that it will pass, considering we've had outbreaks recently?
Well, I think that increases the odds that it will pass if you understand how important it is for as many people as possible to be entered into the immunization registry, because that enables the state, the Department of State Health Services, other authorized entities to look at the big picture and not worry about, well, how come we don't have people registered from that part of the state? There's been an outbreak there. We need that information. So I think it's very important.
Another interesting topic I wanted to talk to you about was medical marijuana. What do you expect to happen this session with that topic?
Well, I expect to file for the 7th time, 7 is the charm, my bill, which I have to say right from the outset, it doesn't legalize marijuana for medicinal purposes, and it doesn't decriminalize marijuana. It creates what's called an affirmative defense. So, if you have a bona fide medical condition, AIDS, multiple sclerosis, cancer, glaucoma, and you're suffering chronic debilitating pain, and if your doctor says, I know some people who've tried this, I'm going to suggest you try marijuana. Can't prescribe it because it's illegal. So you have these two little conditions. You have to have a bona fide medical condition as determined by your doctor, and then the doctor has to have suggested it. If you then get arrested in your house, per this legislation, this is the affirmative defense, you can go before the judge, you can say, Your Honor, look at me, I'm not a criminal, I have multiple sclerosis, I'm in a wheelchair, my doctor suggested this, it helps me live. The judge, and this would be a judicial determination, the judge would be authorized to say, you're clearly not a criminal, this is helping you, your doctor suggested it, charge is dismissed.
What do you say to the people, though, that might be scared that this is a pathway to legalizing marijuana in general in Texas?
I say that that is not what I am trying to do with this bill. I am trying to help people who are genuinely, legitimately sick. Now, there may be other bills, and I think there will be, to legalize marijuana for medicinal purposes, to decriminalize marijuana, to legalize it for recreational purposes. That's not what I'm about. I think you can look at my record. I've gone with this very conservative authorization of medicinal marijuana in limited situations. And I think the members of the legislature and the public should know that's what I'm trying to do.
So if you've filed this for 7 sessions now, you said, correct?
6. This will be the 7th.
This will be the 7th. Have you seen any more support each session?
I have. And last session we had a public hearing in the Public Health Committee, and the testimony was so compelling. These are very courageous people because they're using an illegal substance, but for, I would say, legitimate reasons, so they can live with the debilitating pain. They came, they testified. I had a couple of members of the Public Health Committee come over to me after and say, I think I understand this. I think I'm going to look at this issue with more open eyes. That's progress as far as I'm concerned. The other part of this is that 20 states, including the District of Columbia, have either authorized marijuana for medicinal purposes like my bill would do, or they've outright legalized it. So clearly the population of this country is moving in the direction of not necessarily legalizing marijuana for medicinal purposes, but creating a mechanism like my bill does so that legitimately sick people whose doctor says, you ought to try it, it might help you, and who get arrested can go before a judge, and the judge would be authorized, even though it's an illegal substance, to say, you have a legitimate, bona fide medical condition, your doctor suggested this, it helps you live, I'm going to dismiss the charges. Go home.
So maybe 7 times. That's the charm.
Exactly.
All right. Well, certainly one we will definitely watch next session. Thank you very much for being with us, Representative. I appreciate it.
Of course.
And you can watch State of Texas in depth Saturday next week, because we have an event on Sunday here on KXAN News, but it will be Saturday at 8:30. Formula One will be on Sunday. NBC's Meet the Press is coming up right after this.